Hello, this is Anne DeGheest, and it's a Friday, July the 23rd. I'm changing my format this month, and we're going to do a deep dive in the first video on vaccination and all the risks for people who are not vaccinated. And pretty much, this is a new art I just did yesterday to try to express my frustration and angers there. And it basically says, get vaccinated or get infected. Please feel free to share this to friends and loved ones. You may be able to save their life because remember, it takes 6 weeks to get fully vaccinated, and we're having, unfortunately, a surge. So the second video we're going to talk about, I've combined some of the worldwide lessons we're learning of what's happening in the rest of the world, as well as some other clinical updates. So what's happening in the US? So we have an outbreak of US unvaccinated, some really interesting data that separate vaccinated from unseparated. You're going to see that the Delta is unfortunately exploded to 83 to 86% of the cases in the US. The cases have jumped 180% in the last 2 weeks in the US, and 99% of the deaths are from people who are unvaccinated. We're also going to do a deep dive on real-world evidence that's coming out of Israel and how the Delta variant is impacting the effectiveness of the vaccine and what we have to do. Do you need a third booster for that? I'm going to give you argument to debunk all the arguments that people are making against vaccination. Please feel free to send this forward, so use my arguments. And then it's pretty clear that some of the protection are going to be coming back, like mask and ventilation. In the second video, I have combined some of the things that's happening in the world. There's some good news and bad news. India and South America have had a massive drop. Unfortunately, Europe and the US are coming back up. And we're going to talk about some updates also on the clinical side with other vaccines and other therapeutics. So get vaccinated or get infected. Masks have come up too early. It's pretty clear that we're not back to normal. Unfortunately, we have all hoped we could just somehow in the last few weeks go back to normal and just have a normal life before 2019. That is not the case. The Delta variant is leading in the US. It's basically wreaking havoc in the unvaccinated. You're going to see some of the data. It is a bit scary there. And the reason why it's so bad is because that Delta variant is 2 to 3 times more contagious than the original Wuhan variant. It's very unforgiving. There has been cases reported where people literally walk somebody else indoor and they got contaminated. You're going to see some fascinating data from Israel that's working with Pfizer in looking at the decrease of the protection against the virus. It is getting more and more evident, but not official yet, that we are going to have to provide a third booster, maybe after 6 months, to people over the age of 65 years old and people who are immunocompromised. One of the issues, the mRNA was built initially against the original version of the Wuhan virus there. And so it is extremely targeted. We are one mutation away, so that the Delta plus or another mutations there will decrease our effectiveness even more. So it is critical that we don't have the virus that continue to spread from host to host and therefore has a chance for another mutation. And the virus is being designed to increase its infection rate, but also to avoid the immune system there. And we have seen in the past that a new mutation could take over the world in 3 months. And we've seen this with the Alpha and the Delta. So we really need to stop this virus to spread around. The other risk that people have is that with more and more data, and I'll talk to this about in the second video, is that the long COVID is real. You have a 10 to 30% chance if you do get infected to develop long-term symptoms, regardless of age and regardless of severity of the infection. A lot of these people were asymptomatic who had very mild symptoms. And you develop brain fog, chest pain, cardiomyopathy, and chronic fatigue. And that will be more in the second video. So what's happening in the US? We have gone up 180% in the last 2 weeks. The Delta now exploded to 83 to 87% of the US cases. And unfortunately, as a result of that, you can see the mortality rate, which has a 4 to 6 weeks delay, is starting to go back up. Only 49% of Americans are fully vaccinated. Good news, 69% of adults have at least 1 dose. But the problem you're going to see is these pockets where 2/3 of the counties in the US have less than 40% vaccination coverage. And that's where we're having all this festering of the Delta variants. Now, if we break this down by age, you can see we've done a really good job at vaccinating the older population there, but now we're going to talk about the fact that the protection wanes over time. And this is the problem we're having in the younger population there, that unfortunately the virus is spreading around. So let's take a look at the different states, and you can see Louisiana now is leading the pack, and it's getting to be the level of the peak there. That was in December to January there. And so it's clearly going exponential. You can see Louisiana went up 238%, but then you have Arkansas, Florida, Missouri, really, really big explosion in the last 2 weeks. It's unfortunately what's called the pandemic of the unvaccinated. And the hotspot, this is the purple color there. You can see right over here in Nevada, part of Utah, Florida, and all the Southeast, and you're going to see it's totally correlated with the low vaccination rate in these counties. And it's 99% of the people end up in the hospitals or dying are unvaccinated. It is the pandemic of the unvaccinated. That's why I'm going to break down the infection rate vaccinated versus non-vaccinated. You're going to see it's a big difference. So if we look at the US as a whole, and we just look in the brown here with the people unvaccinated, we're now reaching again the level of April. And you can see it's going to go up. So we're probably going to have the unvaccinated having some of the same infection rate that we had probably in the spring and hopefully not during the winter time. If we look at Missouri, for example, you can really see that on July the 17th, they were at the peak of what Missouri was experiencing in December. And unfortunately, we have learned with this virus that when it goes exponential there, it takes a while before we can control it. Several other states like Florida, Louisiana, and Arkansas having that same explosive curve you can see in the brown there. So I think it's creating great that we can now separate the infection rate of people vaccinated versus non-vaccinated, and it's clearly being driven by the unvaccinated. As a result, remember there's a 4 to 6 weeks delay before we get to the hospitalization. And you see the hospitalization is starting to crank back up, and it's getting to the level we had in unfortunately, the spring season there. So we don't want to see that. That's when we had an increase in mortality. So hospitalization is up in Arkansas, Missouri, Nevada, and Florida. These are the states you can see there's clearly a correlation between vaccination, where the hospitalization is going down, and low vaccination, which is less than 40 to 50%, where we clearly are having a rampage of the Delta variant. So we have also dropped our vaccination rate. At the peak, we are at 3 million per day. Now we have dropped to 532,000, but it's also spread out all over the places. The best state is Vermont. And as you can see, some of the states we've seen there are below 40%, and that's where we're having all the hot spots. It's estimated that it will take 9 more months to get to 75%, which is what we believe is needed now for the herd immunity for the Delta variant because it's so much more infectious. 9 more months, that's a lot of things will happen there. And so we really need to shorten that period. Otherwise, we're going to go for a very difficult winter. So just as a quick reminder, there's a new variant called the Lambda variant. The Lambda variant is in South America. And we'll talk a little bit about that in Chile, Peru, Ecuador, and Argentina. Now, the good news, it looks like the vaccines are effective against that variant. Delta, unfortunately, is spreading across the world and is now the dominant variant. It's also associated with hearing loss, which wasn't the case in some of the other variants there. So just be aware of that, that it has additional symptoms than just the traditional one. Now, we're going to talk about Israel. Israel has 80% of their population vaccinated over the age of 16, and they have these incredible medical records that allow us to keep track pretty much close to real time what's happening there. What is worrisome, that we shall spend more time on, is that they're now reporting data that 50% of the vaccination of the infection rate that end up in the hospitals there are people who have been fully vaccinated. We call this the breakthrough cases. So I'm going to spend some time trying to understand what's going on there. They're also reassessing lifting the lockdown. They extended blocking the border from July 1st to August the 1st. And then we have this new Delta Plus, which is an additional mutation from the traditional Delta. And this is this new mutation that the K417 and which decrease again the antibody effectiveness there. So we need to keep an eye on that one. So let's a quick reminder. The Delta variant, which is kind of the dominant one, is the B1617.2. It's an alphabet soup. This is a big difference there. If you remember, in the original Wuhan variants, one person was infecting 3 people there. The difference is that with this variant, one person infects 6 people. So it doesn't take much to get infected. The other thing is that this variant has a much higher viral load, which means passing somebody or very quick interaction there, which wouldn't have created enough viral infection in this case, could create enough exposure for you to get infected. So look at the Delta variant in the UK. You can see how it's taking over the world. And this is what we don't want to see. This variant takes over so quickly the world. And that's why we need to absolutely stop this virus to spread, because it always has a chance to mutate and become another dominant variant. In the US, you're going to see that, it is now becoming in a period of literally a month, we've gone from 20% to 87%. It's taking over the US. So this is the specific. You can see the Delta variant is 79% to 86%. The B117, which was the original British one, is kind of disappearing. And some tiny bit of good news there, the P1, which was this thing from Brazil that unfortunately is really good at escaping vaccine, is being taken over by the Indian one, because the Indian one is so much more contagious. But unfortunately, it is spreading like wildfire. And you can see how quickly it happened. Literally in the period of five weeks there, we totally exploded. So let's break down highest versus lowest vaccination rate. Arkansas has only 35% of the population were fully vaccinated. And as a result of that, you can see they're having that huge surge there. Unfortunately, we don't do enough genomics there. So with the data as of July 14 for the Delta variant, but you can see that's the one that's driving the caseloads. Connecticut, on the opposite side, is 62% vaccinated. That's where you can really see the difference in the vaccination rate. And yes, they're having some Delta case, but they don't have that surge that we're seeing in the other states who have low vaccination. So clearly, get vaccinated or you have high risk of getting infected. Let's look at the vaccine clinical data. So this is going to be clinical information, but I really want you to understand there's a lot of information have come up in the last few weeks there. So this came back from Eric Topol, who is a very big clinical leader in the space. And the data is starting to show, we're going to do a deeper dive, that when we think it's 96% protection, that's only against severe cases that drives to hospitalization and death, okay? The data is starting to show that a protection against infection is 79 to 88%. I'm going to show you some more recent data that show it's even maybe lower than that against the Delta variant. But Moderna is similar. AstraZeneca has lower protection and especially against infection. You have a higher chance of getting infected there. And then there's no data on J&J. And then the Bharat BioNTech shows also 65%. So again, I want to emphasize a 2-dose mRNA only protect you against severe COVID and hospitalization. You could still get infected. You could still be contagious. And you really need to start thinking that if you're in an environment there with people who are infected, and there's been several breakthrough cases I'm aware of where people were taking care of somebody who was infected and they got it. So the amount of exposure to somebody who was infected, if you're vaccinated, you may still get infected. And these were not mild symptoms. These people did get sick. They didn't end up in the hospital. They got quite sick. Remember, the kids under the age of 12 won't get a vaccine until probably late this winter. So they're going to be a valiant in spreading the infection. And so we should expect in August and September, as the schools are reopening in person there, that there's going to be these kids spreading the virus against the population there. And more data, you're going to see that Israel is now starting to look at doing a 3rd dose booster for immunocompromised people and people with the age of 65. So let's look at some of the data. So the PRNT50 is a way to look at the antibody neutralization there and how do they react to variants. And you can see the B117, which was called also the Alpha, the original UK one, has a pretty good defense. But as we're getting to Delta, you can see it drops a little bit there. And of course, we know for the Gamma, which is Brazil, and the Beta in South Africa, it is lower. So again, I want to reemphasize that a future mutation could change the whole protection there. So we need to really understand what is happening with the mutation. So another data that just came out is comparing the mRNA from Pfizer against Sinovac, which is one of the Chinese vaccine. And it's important there because a lot of the Chinese vaccine are being sold outside the US, like a lot of them are in South America and part of Asia. And the Pfizer provide 10 times more antibody than Sinovac. 10 times is a huge difference. So you have a much higher protection. And you start to see that in some of the outbreak that we're seeing in some of these countries. If you're vaccinated, what are your risks? So CDC data show there's been 5,189 cases out of 159 million vaccinated. So that's great. That's 0.003%. But 75% of those patients were people over the age of 65 years old. Okay. And that's important because I'm going to show you with more data that clearly the vaccine are waning out faster for people over the age of 65. It's also still unknown how the Delta variant could affect the transmission of the virus there. So you may still be able to contaminate, and we have no data on long COVID. The question is that if you do get infected, are you at risk of getting long COVID there? So now the recommendation, if you get exposed, and if you do get test positive, you should go into a 10-day quarantine, and you should make sure that you're being checked for symptoms. A new symptoms for Delta is a runny nose. That wasn't the case with the Wuhan virus, so just keep an eye on that. Don't think you have a cold in the middle of the summer. Just keep an eye and just get yourself tested. CDC is saying if exposed and you have no symptoms, no need to be tested, but watch for symptoms for 2 weeks. I would still think that if you think you've been exposed, a lot of the tests are free, so please get yourself checked. Now, this is concerning. Older adults have shown an attenuated immune response over time. And you can really see the difference in the age group. So in blue are the young people, and then in dark, in red, are the 56, and then green, the 71 years old. You can see the 180 days, so 6 months, there's already a big drop in the antibodies there, but there's a much bigger drop for the older populations there. That's why there's more and more concern that we should probably do a third booster there. So if we look at the B1351, which is the one that evades the best the immune system there, this is the one from South Africa, you can also see that the older population there pretty much dropped very quickly, 120 days, which is roughly 4 months. You can really see it drop very, very, very low. So I think this is something that we have to seriously consider. So CDC is showing 93% protection for the mRNA against severe COVID. They're now talking 64% is the protection against getting infected. That means you have a 36% chance of getting infected if exposed. Delta is much more contagious, so it takes less exposure to get infected there. So just be aware of your environment and where you're going. If you're going to a very crowded space indoors, you may want to consider wearing a mask or just be careful where you're going. I'm going to now do a deep dive on Israeli data. Israel is incredible. They made a deal with Pfizer to get access to the vaccine and be able to vaccinate their population there in exchange of sharing longitudinal data on a regular basis. This is what's interesting. 33% of the population had a vaccine 5 months ago, which means we're now starting to see if the vaccine is waning or not. What they're showing is that it is waning, and morbidity and hospitalization is being impacted. There's now 2 data sets have come out. One a couple of weeks ago showing that the prevention of infection has decreased to 64%. And that's especially the case for people over the age of 65. But more importantly, today, it's a smaller sample, so we have to see if it gets repeated. They think that in the last few weeks, the protection has dropped to 34%. So we may have what they call a drastic drop in the protection in the population there at 5 to 6 months. So that's something we need to absolutely get on top of that. No, just to be clear, it means that doesn't mean you have a 1/3 chance of getting infected. That means if you compare yourself to unvaccinated people there, you have a slightly better protection, but not the protection we used to have. So we're not back to normal. The unvaccinated outbreak in the US is growing to be maybe up to the level of the winter surge, and that we need to be careful in the next month. We'll know that. And mask recommendations are going to come back for indoor public settings there, and I'll talk more about that. So let's look at some interesting data. if we look at the efficacy after one dose, what has been shown is that with the alpha, we had 48% efficacy, but the delta was only 30%. When you have two doses, with the alpha, it was 94%. That's how they got approved. But with the delta for Pfizer, it's 88%. And for AstraZeneca, which is a lot of Europe and the UK, it's 67%. So you can see that these variants are really impacting the effectiveness of this vaccine. Another data showed, you can see the impact on the antibodies there. This is the Wuhan, which is the amount of antibody created. You can see on the delta there how much of a drop we have in the amount of antibody protection. And that's impacting both AstraZeneca and Pfizer. It's quite a significant difference. So Delta, for example, has shown that it's impacting the Pfizer efficacy by 5.8x, which means it's critical that you have two doses. The first dose is not protective enough. For the Delta, you absolutely need the two doses. That means that from the time you start the vaccination to the time you have good protection, it's 6 weeks. You need to start the process now, because the next 6 weeks, you're going to see an increase in the Delta cases in the US. So Israeli data is showing neutralization antibody are fading over time. This is around 120 days, which is 4 months. And this is where we're getting concerned. You start getting at 200 days, and you can see that the people over the age of 56, which is the red line, or people over 71, which is a dark line, are dropping pretty fast. And so that is something that we need to really get concerned there, because we may need a booster for the immunocompromised in the people over the age of 65. So are the T cells lasting and protecting us as opposed to the neutralizing antibody? Neutralizing antibody do go down with time, but the hope was the T cells may kick in. Now, on the positive side, in 2003, they showed the data that the T cells were lasting longer, okay? But data has just come out showing that the T cells respond with SARS-2 is different than SARS-1. And so that they are having a T cells responded that is unfortunately not what we were expecting there. So unfortunately, it's extremely difficult to do T cells research. A lot of these data sets are small. You can see there's only 24 infected subjects there because it's so difficult to do this test. But we should not assume that what happened with 2003 SARS may apply to us. I mean, it's clearly showing that we're having a different responses with the T cells. It's lower than we expected. So could the mRNA protect for years is another article that just came out from Nature this week. And on the positive side, it seems that the mRNA are inducing a persistent human germinal central response, okay, and central in French. And they've done a test looking at the lymph nodes, doing fine needle aspirations there on 41 patients 12 weeks after the second vaccination. And what they saw, which encouraged them, is that the dropping in the germinal centers was lower than what normally would happen when you get a vaccine, i.e. the hope, but not a validation yet, is that we may still have that T cell protection over time. So I'm giving you the two data sets, but it's not clear cut that the T cells are going to come to a rescue there. It is only small data points. So let's look at Pfizer, because the data from Israel is real world evidence. So they look at hospitalization and severe cases. In green are fully vaccinated, in red are unvaccinated. And what you see in the last few weeks there is an uptick of the fully vaccinated who end up having severe cases and being in a hospital. And that is the concern that the vaccine, which they remember, they got a lot of their vaccine in January and February, are starting to wane off in the population. So then they start looking at some interesting data. The Israel government reported a sharp 60% drop of efficacy against hospitalization. Let's look at the data here. This was done by Evercore ISI, is that between June 6th and July the 3rd, the protection rate for hospitalization was 85%. At the time, Israel reported 93%. This is what's concerning. From July the 4th onwards, so in the last 2 to 3 weeks, that protection has dropped, which is the worry that you have the weaning of the vaccine as you have a third of the population. So the data from Israel is being watched very carefully across the world there, because we may have that decrease of the vaccination. And The good news is not anybody under the age of 50 had a serious condition. So we go back to the majority are people over 65. And I think it was one case between 50 and 65. So again, going back to the immune system, not having the same response for the people over the age of 65, and therefore, dropping their protection faster than the younger population. So we have had 432 million doses delivered in the US. You can see Pfizer and Moderna are dominant, but you have a kick-in of the J&J vaccine in the last couple of months. You're going to see the vaccination is all over the map based on what's called a social vulnerability index. And there's some really interesting data. Unfortunately, Texas refused to participate, but you can see a different part of the county there. In red is what you don't want to see, which is a low vaccination rate for people who are very at high risk, like Hispanic and the Black population, or the poor population there. And that's where we see the outbreaks. So vaccine tracker by ethnicity, people who have at least one dose. You can see the Black population is mostly under the FAIR curve, which is less than 40%. White population is a much higher vaccination rate. The Asian is lower, and the Hispanic is also below the curve. So if we look at Hispanic population, which is in the orange, are people who are below the percent of that population. So if you have 20% of the population that's Hispanic there, and if you have less than 20% that's vaccinated, that's when it becomes orange. And in purple is a greater share. And you can see pretty much across the country there, we have a Hispanic under-vaccination that we really need to work on. In the Asian, seems to be doing pretty well across the country there. And the Black is again significantly under-vaccinated. That's where we see some of this outbreak is in these zones, in this area here, there. So it's more than just asking people to get vaccinated. We have to really outreach to the social economics and the different ethnicity. And you can see the white vaccination rate in most part of the country. They're doing pretty well there, a little bit lower there in some of the hotspots like Tennessee and Kentucky, and of course, Arkansas. So Americans should prepare to have a booster shot is what came out of Vivek Murthy, which is our US Surgeon General there. And you can see this is the worry we have, is that dropping of the protection there. And what's clearly showing up from Israel is that there's different rate of dropping there based on your age group. So masks are probably back. The World Health Organization, but not the CDC, are encouraging people to wear masks indoor, including vaccinated people. CDC is still requiring masks in airport, planes, trains, and hospitals. California has started recommending masks again indoor due to the surge of the Delta variant. San Francisco Bay Area is urging people to use masks indoor. Los Angeles now is requiring to have masks indoor. And masks remain optional for everybody that's outdoor. If you have an area with a high infection rate, you still want to be careful if it's a crowded event. You should wear masks in high-risk settings like crowded stores or indoor church services. Especially be concerned if there's poor ventilation where you're going, or if there's a very high community transmission where you live. The Pediatric Association now has just recommended masks in school for everybody over the age of 2. But there's 9 states that have a law prohibiting masks in school. So this is going to be unfortunately politicized. Indoor ventilation, be very aware of ventilation there. Try to introduce outdoor air as much as you can. A lot of the schools are starting to use fans and upgrading their ventilation system and using a higher ventilation system there to increase the workflow, the airflow, and also trying to get the air out, especially from restroom. A lot of the restrooms have poor ventilation, and of course anyway, so you need to generate less air movement there, or try to, people are looking at exhaust air grills and doing everything you can in some of these public settings there. And then you should consider ultraviolet germicidal irradiation there. It does inactivate the virus in a couple of hours. And so people recommend, like employers, for example, to run this at night before, after people go into the building. There's a lot of different systems there at pretty low cost that people need to look into it. So you're going to see a lot of employers looking into this as well as the school. So what's the issue? I think the fight we're having right now is the right of the individual right, don't tell me what to do with my body, and the right that we have to live in a society and we need to protect the other people in the society. So in the US, you start seeing the schools and the employers starting to require vaccination. There's now a big case in the Bay Area there in San Francisco, where the restaurants are asking for proof of vaccination to let you inside the building. You start to see the colleges requiring that before people come back when the school reopened. In France, they were pretty smart. What they did is to say, okay, if you want to live in society there and you want to go to a restaurant, take a train, visit the shopping center there, visit a movie theater there, you're going to have to show vaccination through a vaccination health pass that they provide with a QR code. Or you have to show that you had a negative test in the last 48 hours, which of course, if you have to do this every day, is impractical. So they literally had 1 million people after they announced this that tried to register for vaccination there. And the fines are pretty serious, $10,000 to $45,000, not for the person, but for the people who let them into the building. For like the restaurants and all of that, and even jail fine if enforced. That's going to be difficult to enforce. But as a result of that, they're trying to drive vaccination. The problem of France is that only 40% of the population is vaccinated. You're going to see in the second video that they're having an outbreak. And so they really need to deal with this. Germany is doing the same thing. They give special privilege for people who go to restaurants and bars. So I think where we're going to go is to say, fine, if you don't get vaccinated, you don't have the same rights to be part of societies and all the other affinities there. And I think that that's going to be interesting across the world so that we can drive vaccination. So these are some arguments that you can use if you have a loved one that doesn't want to get vaccinated. Can you get COVID from the vaccine? Absolutely not. There is no pieces in the US in any of the vaccine that have an active part of the COVID. Can you have long-term side effect of the vaccine? Most serious vaccine side effects have been caught historically in the first 6 weeks. And that includes polio, yellow fever, and smallpox. And we've not been giving vaccine at a very high volume for the last 7 to 8 months. So there's a pretty strong sense that it's very secure. If you already had COVID, do you need a vaccination? Yes, they recommend that 90 days after you've been infected, you should get 2 mRNA doses. And the immunity, and we showed this in the last month's video, of people who have had a mild infection rate is not very good and goes away after 3 to 5 months. Can vaccine hurt your fertility, both for men and female? Absolutely zero evidence. This is unfortunately fake news on social media. It is none of your business. Here's the issue there. All the vaccines are not 100% effective. You can still carry the viruses to friends and loved ones and hurt them by passing the infection there. Some people are immunocompromised. They have cancer therapy or they just have some immune disorders there, and you could give it to them, and you could give it to the kid who was less than 12 years old. And you're allowing the virus to continue to replicate with the risk that we have a new mutation that drops the protection even more than we have with the Delta variant. So another argument is that I'm young, I'm healthy, I'm invincible, I don't need to be vaccinated. Unfortunately, young have up to a 30% risk of becoming long COVID patients. And that could be for 9 months and counting right now because we don't see any improvement with the long COVID. COVID doesn't have to kill to wreck your life. I think it's something worse than to be handicapped and not be the same for the rest of your life. And unfortunately, more young people are being hospitalized, and you see this in the news. This 5 or 13-year-old were dying because the parents refused to let them being vaccinated. It's kind of heartbreaking. A vaccine have only EUA, which is an emergency approval there, not full FDA approval. And that's because historically the FDA wants to see 1 to 2 years of effectiveness data there. So both Pfizer and Moderna now have gone to the FDA asking for full approval. And unfortunately, the FDA has come back to say, we'll take them 3 months to review the data. So stay tuned. My faith will protect me, and that comes a lot from the wide evangelical Protestant there. And honestly, I'm trying to be polite here, but God gave us a brain to think and reason with. And this is why we accept polio, smallpox vaccine, and all the other vaccine that we give to children when they go to school. And I think COVID is just another one of those. I can't afford the vaccine. The good news, it's free. The bottom line, not getting vaccinated could set everyone back. It has. We now have a 4th wave that's starting to happen in the US. Virus is continuing to mutate. And as I said, the virus is mutating to try to escape the antibodies, and you don't want to give it a chance to do that. So I hope this helps some of the argument you could have. Now, the reality is that, this is not the flu. We have lost 1.5 on the average up to 4 years due to COVID last year. And the female have dropped as well as the male. But then when we look at different ethnicity, you can see that the Black men and Hispanic have lost 4 years of their life. That's because we had such a higher mortality rate in that population there who was the essential workers. This is to give you an idea that Hispanic male got hit the hardest one. And we saw this in California there, where we had a significantly higher infection rate for the Hispanic population than the percent of the population. So please stay positive, wear a mask, and get vaccinated. Watch my second video where I've combined the clinical and epidemiology update and a lot of very useful information. So make sure you don't miss it. And please spread this video to your friends and on social media so we can help some people to get vaccinated and hopefully maybe save their life or make sure they don't get long COVID problems.